Welcome to the CTA Foundation CES interview series. My name is Steve Ewell, and I'm the Executive Director of the Consumer Technology Association Foundation. And I'm pleased to be joined by Dr. Karen Feinstein, the President and CEO, and Nancy Zionts, Chief Operating and Chief Program Officer at the Jewish Healthcare Foundation. Welcome to both of you.
Steve.
First off, Karen and Nancy, for those of you that don't know about your foundation, can you share some highlights about your work?
Well, our foundation began almost 31 years ago, maybe 32 years ago, with the sale of Montefiore Hospital in Pittsburgh. And the assets were converted into a grant-making organization. But when they asked me to be the CEO, I would have to say at the time, I didn't find grant making as exciting as advocacy and activism, just something for which I have a lifelong passion. And so we do a mix. We definitely give grants, but we also do a lot of advocacy, research, teaching, and coaching. And I think we've stayed pretty close to our activist roots. We also do quite a few demonstrations, often with government funding. And so we bring in more grants usually than we give out. We bring in more in grant money than we give out, which makes us a rather complicated organization. And I think the best way to describe us is we're four parts. If you took Latin, Gallia est omnis divisa and partes, right? We're divided into four parts. So we have the parent organization, and then we have a regional collaborative called the Pittsburgh Regional Healthcare Initiative. And then we have Health Careers Futures. And then we have an organization called WHAM Global, the Women's Health Activist Movement. So we play also in different arenas, as you might have noticed. We definitely do a lot local. We do a lot of our demonstrations are local and regional. But we also serve the state. The Commonwealth calls on us to do quite a few things. And then some of the things that we want to accomplish need to be done either on a federal demonstration level or with federal advocacy. And then our Women's Health Activist Movement has global reach. So we have board members getting out of bed in Australia, going to bed in the Middle East, and everywhere in between, from the Netherlands to San Francisco.
Well, it's really important work that you're doing. And I always love seeing foundations that are able to think outside the normal foundation box and figure out ways to really accomplish the mission that you have. And, you know, we've talked before when you've been at CES, and one of my goals has always been to engage more of the foundations, especially some of the ones working in the aging field. And I know you're much broader than just aging, but that's one of the key areas that I really enjoy working with your foundation on. So, I've been thrilled to have you participating at the CES and really bringing together a diverse set of innovators in both the healthcare and the technology world as we're looking to address the challenges that we're facing moving forward. I'd love to get your perspective on how can foundations help drive some of this innovation? How can we really push things forward?
What worries me about foundations, well, and I could go through a long list, those who educate our health professionals of tomorrow, people running our health systems. I don't know how you can miss the Consumer Electronics Show, particularly the Digital Health Summit. If you don't know where the world is going, how are you going to help people get there so that we are the very best that we could be at keeping people healthy and helping them recover when they're ill? And so the Consumer Electronics Show just opens our eyes, ourselves as a foundation, because that is our privilege and our responsibility as a foundation to help our regions, our states, our nation make that journey from where we are now to where we could be in a future that's much brighter and that keeps people healthier. So I'm sad at times that often people will say something to me that is in this vein. Technology is not the answer. No, technology is not the answer, but it's a big part of the solutions that we are going to collectively, humans have to implement them and install them and use them and build on them. But there's no doubt that technology gives us opportunities we would have never had before.
Absolutely. And that is, one of the big things that I've always focused on is even being someone associated with the technology industry. I recognize technology as a tool. It is, it doesn't replace the caregivers. It doesn't replace the individuals in the system, but it is a massive opportunity to help advance the care that we can have and really advance the work that we can all be doing together. So it really does make sense to have all of us, at the table having these discussions and, making sure that the technology is designed in such a way that it really is helping people move forward and be healthy. So really appreciate the work that you're doing in that space. You also—
well, Steve, look at us now. I mean, we're on Zoom in the middle of a pandemic, having a very productive conversation. And if it were a larger meeting, I could be conversing with you, which I couldn't do otherwise in person. I could be having a chat with you about something related to our speaker. I could be mounting linkage up there to items we're talking about. We could be sharing the screen. I mean, we like to say we're making the best of a bad situation, but sometimes even using the technology we're using right now, we may be making better. It's a bad situation, but I can't say Zoom at times doesn't make our connection better.
Absolutely. I think there's just some amazing ways that we can be connected even when we can't be together. And that is such an important piece of what we're all trying to do. And that also leads to a little bit of inspiration that you took, from your time coming to CES. And I'm just thrilled to see it come together there in Pittsburgh with Liftoff. Can you share a little bit about the conference and what you're doing at Liftoff?
Yes, and Liftoff came directly from our visits to the Consumer Electronics Show and the Digital Health Summit. And we say, I'm sitting here now in the shadow of Carnegie Mellon University. I am sitting here right now, close to the presence of our intellectual thought leaders in artificial intelligence, robotics, computer science, machine learning, and we could keep going, virtual reality. And yet, so many of the spin-offs that come from Carnegie Mellon that we all celebrate, they take all of the technology and apply it to safety platforms in other industries. So for quality assurance, safety in terms of anticipating harm, preventing harm, we have people now that I could walk to their headquarters and they can send a 18-wheel semi barreling down the Pennsylvania Turnpike in our typical right now snowy, sleety, slick conditions with no driver, and it can safely navigate the Pennsylvania Turnpike and refuel. And yet, whatever technology anticipates harm and corrects automatically, autonomously, that hasn't been applied to healthcare. We don't have anything like the NASA Command and Control Center. When we have them in our health systems, they're not looking at safety. They're not anticipating harm and correcting. And so one of the things that Liftoff was intended to do is to inspire a local industry to say, look, you are doing so much using the cutting edge of technology for other industries. Please bring it to healthcare. And just, we want to give you a taste of what that would look like. So Liftoff was definitely inspired by what we see when we come to Vegas.
Well, and I think that just leads to, better together. The more that we can do with CES, the more that we can do supporting Liftoff and really engaging communities across the country to identify and build the it's amazing to see where the next generation of innovators are going to come from. And it's a matter of having them engaged and at the table from all over the country and all over the world to really lead to greater opportunities for all of us. So yeah, thank you so much for doing that. And I can't wait to see what gets inspired out of Liftoff and really takes off to help us all age healthy. So thank you for that. I do want to dive into a couple of the programs that you operate through your foundation, and one of which, certainly we've dealt with a lot of social distancing, physical distancing this year, but I've been proud to say that as the CTA Foundation, we were one of the supporters of the Virtual Senior Academy, and I'd love to hear how that went this year, given all the challenges that people had being physically distanced from each other.
Well, one year I brought with me to the Consumer Electronics Show one of our youngest staff members, not yet 30 at the time, Mara Leff. And we'd been playing with the Virtual Senior Academy idea, but we just hadn't gotten off the ground. And Mara took hold of it and ran with it. And it started to really gain traction. And we were getting more and more people signing up, more and more programs offered. And then COVID-19 hit. And suddenly we were in demand everywhere. The large health systems wanted to use us. Our local OSHA wanted to run their programs over the Virtual Senior Academy. We were giving health tips. We were doing things way beyond anything we imagined, but also we were a lifeline for people who were now incredibly isolated in skilled nursing and assisted living residences. We were connecting them to the world, not just with a screen, but with an ability to interact. And that was the key to VSA. It's not just about, I have a screen so I can watch stuff and listen to people, but I can engage. And it became so popular, it outgrew us. And the Jewish Community Center, which does a lot of senior programming, said, we would love to be the home. And they've been nurturing it, and it continues to grow. So it began before COVID. It came out of an experience Nancy and I had at Carnegie Mellon when we saw a model out of New York that looked somewhat like what we eventually created. But COVID made it so much more in demand, and now a much wider usage in our region.
There is, I can only imagine the level of demand really beyond the region and across the country. So I really applaud the effort that you put into designing that and the innovation that Mara had in taking that idea and running with it, and the foundation being able to help embrace that opportunity. So that's great and amazing. You also have a statewide learning network that you've created this year. Can you share more about that program and the way that you've been able to engage these state leaders?
Sure. Thanks, Steve. The Jewish Healthcare Foundation has been involved in training in skilled nursing facilities for over a decade. And we would go take our team and we would go face to face and train the frontline workers and the managers, et cetera. Well, enter COVID, and that no longer becomes possible. And yet it becomes so much more important. So we were asked by the state if we would stand up a learning network for the 1,880 long-term care facilities in Pennsylvania. We did that over the course of 3 weeks, and it is now 9 months old. And what we've been able to do is provide ongoing learning using a web-based platform that we have that contains hundreds of documents that we are able to curate for people so they don't have to go hunting and pecking on the web and finding all the information and figuring out what's current and what's relevant. We do all that for them, and we couple that with ongoing webinars on various topics. So they can learn real time with their peers. They can do it asynchronously through the recordings that we post, or they can have a learning network online where they can answer questions in a forum together. And we've had over 5,000 people engage in that over the course of 9 months. And it was supposed to have ended at the end of November, and we've been asked to keep it going, and we're happy to do that.
That's amazing. I can only imagine, 1,800 centers and 3 weeks. That is quite a challenge. And it's obvious that you've risen to that challenge and continue to do so. But I know that has been one of the biggest issues we've seen across the country, is just organizations looking for information. How do they adapt? How do they adjust to, to address the pandemic and keep their communities safe? So being
And
able to have,
it's not just a question of what are the topics that they want to learn. They actually want to hear from each other. And so technology has been a great connector for people. So it's been giving us the ability to pull together the best experts from across the state, in some cases across the country, to come and be the expert trainers and teachers that you would never get for a 30-person long-term care facility or a 200-person skilled nursing facility, but you can do that in the virtual space.
that's great. How else does technology play a role in some of the other programs that you run and operate throughout the year?
Well, one of the programs that we started last year was the GRAND program. It's a grandparent reading program, and it was intended to bring together seniors and children of a preschool age for a reading program around books that would train them around, teach them about values and build a stronger, more empathetic community. And the first round of those were held in person, with seniors going into daycare centers. But of course, as soon as the pandemic hit, it was not possible to be able to do that in person. We converted it to an online reading program. So you can still, in a Zoom setting, have seniors reading to young children, giving their parents who are at home a break, and connecting seniors and younger people together in something that they love to do. And we're going to continue that in another series starting in January, this time using as seniors those who are in skilled nursing or long-term care facilities, but want to connect with the outside world since they can't have visitors.
Oh, that sounds like an amazing program, and is so important for all the participants, both the children as well as the older adults. So that's great. Being here at CES, even if we're doing so digitally this year, it's a chance for us to see some of the emerging technologies that are coming down the pike. Are there certain technologies that you're both excited to see coming? What do you see coming that is so exciting for you to use and with the communities that you're addressing?
I think I might have touched on one of the things that really excite me, but I look at NASA and I say, look, you can send somebody, into orbit. You can send someone to another planet. You can explore the solar system, and you can bring people home safely. You can anticipate everything that could go wrong and correct for it. So I say, why can't I go into a hospital and have some central control predict not only if things are going to go wrong, but when things start heading down that road, and intercept them and get me safely in and out of that darn hospital. Mm-hmm. So I look at NASA and I look at their command and control center, and I crave that in healthcare. I say, now I do know that we have some command and control centers. There are a few health systems that have them, and occasionally a smaller hospital, but they use them for financial reasons, so that they don't have empty beds, so that the beds are cleaned out and refilled as soon as possible, and moving people through the surgical suites as speedily as possible. But what they haven't done is what NASA does. NASA's is also a safety precaution. It is looking, they have set in every sensor you can imagine to know when things start to go awry, so that they make the necessary change to make sure things don't go awry. So if you ask me, it would be skilled nursing as well. It would be seniors in their homes. We have the technology. Why aren't we deploying it?
And Steve, I'm going to add to that a little, since Karen transitioned us into skilled nursing facilities. There are a range of technologies that we could be using to help the staff know where to use their time appropriately, who needs them when, not just to be doing things on a schedule. So when we were down at CES 2 years ago, I saw some wonderful products about predicting incontinence and preventing incontinence so that the staff were able to intervene with a particular resident before there was an incident, and that both saves embarrassment as well as a lot of work and a lot of resources if you can intervene in advance and prevent something from happening. Same is true with persons who wander with dementia and the ability to make sure that they are safe. So those are the sorts of things that would save a lot of time for the staff, would save a lot of injuries for residents. And the last area that I see using it in skilled nursing is for this connection and communication. So many of our residents in skilled nursing facilities do not have family who visit, do not have family that may live in the same town as them, and the ability to connect them, as we've been doing during COVID-19, to enable them to talk to each other, to have family conferences with staff members to make decisions about somebody's care, to let them know whether or not someone is deteriorating or someone is recovering. You know, you can put it in writing, you can do it on a phone call, but if you can visualize it and bring all the parties together, it has everybody leaving with a different sense of accomplishment. And I think that we could be using telecommunications in a different, more consistent way to bring together care teams across time and place and family and care teams across time and place.
All really exciting areas, and I do completely agree. There's an amazing opportunity for this to address needs that really exist out there. Well, I've really enjoyed this conversation with both of you. I'm just so impressed with all the work that you're doing. You know, if people want to learn more about the Jewish Healthcare Foundation and potentially support the work that you're doing, you know, where should they go to find out more?
So you can come to our website, which is jhf, like johnhenryfrank.org. And if you go there now, the first thing you'll see on the cover page, we hope you'll watch a 20-minute documentary on what COVID-19 exposed in long-term care. And it will give you a chance, if you want to get further involved with us on work about improving skilled nursing or nursing care facilities, please feel free to leave us your information or tell us how you'd want to get involved. But our programs are all listed on there, all of the ones that Karen mentioned across each of our organizations.
And we would ask people, look at the major problems we have now in healthcare. Be creative, because whatever the solution is, there's a technology component. But to accept what is now as given is a huge mistake. Almost everything we're doing could be improved. It's just the way of the world. And our partner in doing this is technology in its many, many forms. But I do worry that people need to be creative in coming up with solutions, but they can't, not only can they not be afraid of technology, they have to at least understand in the most rudimentary way how it can be used for safety and for quality and for comfort and for connection.
I agree. And I really think that's where it's so important for us to be having these discussions, to be bringing together these diverse communities, getting different viewpoints, getting different backgrounds, and engaging and being willing to be open to what can technology do, what can healthcare do, you know, how can we all be better by working together. So thank you again for all the great work that the Jewish Healthcare Foundation is doing for both of you and your teams. Really just we're always happy to continue to be a partner with you. So thank you.
Great.
And
Thanks,
we
Steve.
can't wait till January. And then we can't wait for the next January so we can be together.
Absolutely. We will be back together in 2022, and we'll be together virtually or digitally here in 2021. For the audience, if you're interested in learning more about the CTA Foundation, you can go to ctafoundation.tech. And otherwise, we wish you a wonderful CES 2021.